Hey, this is Kate with Environ here with Terry Wojak, and thank you for coming to this call about GlycoAla and OmniLux Contour Mask. Our guest speaker today is Terry Wojak, and I'm just going to give you a little bit of background on her and then turn this conversation over to Terry. So Terry, oh, so sorry, dog barking. Terry has 20 plus years experience in the aesthetic industry, and she is the national educator and trainer for GlycoAla. She is the owner of Aesthetics Exposed, which is an educational company for estheticians. She has built over 50 courses based on skincare in the medical industry and written more than 100 articles for different skincare magazines for professionals. Terry has also written 2 books, one called Aesthetics Exposed, Mastering Skincare in a Medical Setting and Beyond, and the other is called Mastering Medical Aesthetics. So Terry knows estheticians all over the country. She's trained thousands of estheticians and medical professionals on incorporating skincare into cosmetic medicine, and she is here today to share more information with us. So with that, I'm going to go ahead and turn it over to Terry.
So let's start with GlycoAla. GlycoAla is a great new treatment. Well, it's pretty new. And it is a treatment that basically helps to get rid of damaged cells. So it's a really great procedure to help with photo-damaged skin. Anyone that has any damage, it's going to help to relieve that damaged skin. It's going to help to get rid of it and make way for new, healthy cells in the skin. So what it is it's a light activated cosmetic gel. It includes hyaluronic acid. So hyaluronic acid helps with hydration. And it also has a glycosphere delivery system. So this is what sets it apart from other sort of photodynamic therapy products that are available, is hyaluronic acid in this glycosphere. So what a glycosphere is it's an encapsulation system. So what it does is it encapsulates the aminolevulinic acid so that it can penetrate the skin more effectively. So you're really going to get that product delivered deep into the skin where we want it to be. It is a highly effective treatment with minimal downtime and risk. So the downtime, usually most clients just are a little bit red for a couple days, and then it goes away, that erythema goes away. There is a chance of getting a sunburn-like reaction, and that typically happens to clients that have more photo damage. So because, again, this product is attracted to abnormal cells, if somebody has a lot of photo damage, they're going to get more of a dramatic sort of side effect, but they're going to see a more dramatic improvement as well. So what GlycoAla does is it enhances the skin tone appearance. So it helps to even out the skin tone. It helps to give you like a nice brightness. You'll see some before and afters that'll show you the difference. It also helps to diminish the appearance of fine lines and wrinkles. So it's going to help to smooth out the texture of the skin. It reduces those visible signs of sun damage and aging. Again, it's helping to get rid of those damaged cells so that the skin looks younger and fresher. It also does great at visibly reducing the look of pores. So those with large pore size, it really helps to tighten the pores. It helps to eliminate the look of pores. It also helps reduce the appearance of oiliness, and it promotes hydration to help with the effects of moisture retention. So those are all of basically the indications for GlycoAla. So why should you get GlycoAla? Well, it is, again, it's a really great treatment. It's something very unique. You get impressive results without the downtime, side effects, and cost they're typically associated with more aggressive treatments. The treatment also provides a more dramatic, longer lasting improvement than like a superficial to moderate peel without getting a more invasive procedure. So this treatment really is for those clients that are looking for something a little more than a chemical peel, but who aren't quite ready for those more invasive procedures such as microneedling or resurfacing lasers and things like that. So this is kind of your middle of the road treatment. Also, that hyaluronic acid in it helps to promote a more hydrated look and skin softness. And also because of that, because you're getting more hydration and skin softness, that also helps to diminish the appearance of fine lines and wrinkles. So basically how GlycoAla came about is there is a medical form of photodynamic therapy. And this is basically what the treatment is it's a photodynamic therapy treatment. And in these medical treatments, they're used for non-melanoma skin cancers. And when they started using them for the non-melanoma skin cancers, they saw the improvement in the skin surrounding lesions after it got rid of them. So GlycoAla, the company behind GlycoAla, GlobalMed, decided to make a cosmetic form of photodynamic therapy that could be available to improve the appearance of the skin. So here is just one before and after showing the reduction in pore size. So you can really see that difference. It is attracted to sebaceous glands and it's attracted to abnormal cells. So it's going to help to tighten those pores and again, eliminate any damaged cells. But this is showing, this is 18 weeks after a GlycoAla treatment regimen. And a treatment regimen is 3 treatments spaced 4 weeks apart. So what you should expect with a GlycoAla treatment. The treatment is very comfortable. Again, it's something nicer than getting a more invasive procedure because it is very comfortable. It's, you know, basically what you need to do is you need to commit to 3 treatments. And those 3 treatments are going to be spaced 30 days apart. We don't like to sell them as individual treatments because you will definitely see improvement after 3 treatments. Most people see improvement after 1 and especially after 2, but definitely the 3 treatments is what's needed to get the optimal results. So we really do recommend that. We don't recommend just to get a 1 treatment and then say, oh, I didn't see anything and not come back. So it's important to get all 3. It's also important to prep your skin with a vitamin A, C, and E product twice daily for 3 weeks prior to the treatment. This is going to help to prepare the skin. So we want to deliver the essential vitamins and nutrients to the skin to get it in its most healthy state so that when we do the treatment, we're getting the best results and we're getting the least amount of downtime or damage because the skin is in a better state. So we really do recommend, we think it's really important to be on that A, C, and E formulation before getting the treatment. Also, if you're a darker skin type or concerned with hyperpigmentation, you should also add in pigment lighteners, as well as an alpha hydroxy acid night cream, which your provider will talk to you about. So basically the treatment starts with a cleanse and a light exfoliation. The light exfoliation is very comfortable. It's usually using either an ultrasonic spatula or alcohol with rough gauze. But either way, it's just going to be a light exfoliation so that the product can penetrate better into the skin. Then the provider will apply the gel with a brush. Now, when the gel is applied, you're not really going to feel any sensation because it's not being activated until the light hits it. So after that application of gel, your provider will massage it in for 1 to 3 minutes just to make sure that it's absorbed. And then you will incubate in a dark room for 40 minutes. So for 40 minutes, we'll put you in a dark room. We ask that you don't use cell phones or computers because any sort of light can take away from the treatment. We want no light, so when we put the LED on the skin, the photodynamic therapy product is absorbing all of the LED light and you're getting the very best results for your skin. So after that 40 minutes, you'll be placed under an LED light for 20 minutes. So the LED light is comfortable. Sometimes you may feel a little tingling or mild burning sensation for the first couple minutes. And that's just, you kind of feel the product being activated. It usually subsides very easily. If it's very uncomfortable, obviously tell your provider. They can use a fan or do something to make sure that you're comfortable. After that, after the 20 minutes, your provider will apply a nice moisturizing healing oil with vitamins A and E, as well as sunscreen. So it is important that you know, especially before getting a treatment, that you really need to avoid sun exposure for 72 hours after the treatment. And the reason is because what we're doing with this product is we're using it to photosensitize the skin. And when we're photosensitizing the skin, or actually those abnormal cells, when the light goes in, it's going to destroy those. So if your skin is photosensitive, that ALA, which is the main ingredient in GlycoAla, can stay within the skin for up to 72 hours. So we really ask that you avoid sun exposure. Wear sunscreens, even if you're in the house, because fluorescent lighting can actually cause a reaction as well if you have bright lights in the house. So I just say to put on your sunscreen like you normally would, and especially if you're outside, reapply every 1.5 to 2 hours, wear a hat, and you can go from there. Also, for best results, you want to drink enough water before and after each treatment. That is going to help both with hydration in your skin, and it's going to help to, your body to work better at eliminating those damaged cells. Okay, so here is a great before and after. We have several, but this is a really good one. And one thing I always see too is they always have improvement under the eyes. And for dark circles, for puffiness, for wrinkles, I really, really see the improvement around. You can see the improvement in her skin tone, her skin texture. If you look at the forehead, the before looks a little more bumpy. It looks very smooth and even after picture. So she really did get a great result, and a lot of people get really great results from this treatment. Here's another one. We recently got this picture, and we don't really say that redness is an indication. So if somebody came in just for redness, I wouldn't say this would be my top treatment to do. But it does definitely help with redness. So this client came in because she wanted overall skin rejuvenation. She wanted improvement in her texture. She got improvement in her pigment. She also got improvement in the underlying redness. So this, again, is a really great result after 3 treatments of GlycoAla. Here is a neck and décolleté. So that can be done as well. And many people now are concerned with the neck and décolleté. Unfortunately, we don't think to take care of it until we're much older. So even though we may take care of our face at a younger age, sometimes that neck and décolleté tends to get forgotten. So this is treatment. This is after only 1 GlycoAla session. So remember, we really recommend the series of 8, but this is after only 1. And then here is, we can also do it on the hands. So you can really see improvement in the hyperpigmentation in the hands, the texture, it looks smoother, it looks more hydrated. So, so it's a really great treatment. We also have Kate on the line, and Kate has had several GlycoAla treatments. So I was wondering, Kate, if you wanted to share a little bit of your experience.
Sure. I'll have to say that probably of all the treatments I've had on my skin, GlycoAla has made, I think, the biggest change in my skin at all. So I went through one series of 3 treatments about this time last year. And then right now I'm on my second of 3 series. And actually it's been a different experience both times. But the first time I saw the most dramatic improvement, and it was really to the point where it was between my second and third treatment, where my husband actually said to me one day, he goes, and guys just don't know how to phrase things sometimes. He says, "Oh, your pores look a lot smaller than they used to." And I was like, oh, well, if he can see a difference, then definitely. And then after that, just people I saw just when I was out working, doing my job, they were all like, wow, your skin is really changing. It's really looking good. So I could tell a difference as far as like texture and tone and tightness. But then the fact that other people were noticing as well, I was like, wow, this is great. So this year I'm going through my second series, and I can tell that between the end of the first series and now, maybe my pores started to revert a little bit. So now I'm seeing them I'm seeing them tighten up again. And anyway, it's just been great. Now we'll talk about the LED red light, but I use that at home too, like in between treatments too. Anyway, it's been a great experience. I'm so glad I used GlycoAla because it's made such a change in my skin. So
Great. Yeah, I've had a couple treatments as well, and I absolutely love it. I just feel like really refreshed after. My skin just glows, and yeah, it looks really great. Thank you, Kate. Okay, so Michelle does have a special offer for you, so she's going to discuss that.
As an introductory offer for a limited time, I'm going to be doing what's the word I'm trying to say? No, I'm trying to the group of 3, the series. The series of 3 is going to be $650. And that is going to include the vitamin A prep, which needs to be done at least 3 weeks prior to starting the series of 3 treatments. And the value on that is $1,200. So it's basically, it's just slightly over half of that, but you are getting the vitamin A prep to start with that.
And it is a really great deal because I'm telling you that most people charge at least $1,200 for the series. So this is a really great special being offered by Michelle. So thank you. Okay, so that was GlycoAla. So GlycoAla is your in-office treatment. Again, helps eliminate damaged cells, going to help to rejuvenate the skin. Now, we also have a new product called the Omnilux Contour. And this is an LED mask that you would use at home to get the best results for your treatments. So basically, this LED mask has similar power and efficacy as a lot of the professional panels that are used in medical and spa offices. You get those medical grade treatments for the comfort of your own home. It is the first flexible home use device that's clinically proven to deliver the right wavelengths of energy to promote global skin health. So if you're familiar with LED lights, it has both red and infrared lights in this mask. And red and infrared are both really anti-aging wavelengths of light. They help to stimulate fibroblasts to produce collagen and elastin. They help to stimulate growth factors. It's anti-inflammatory, so it's going to get rid of any inflammation in your skin. It is FDA approved for the treatment of fine lines and wrinkles. So you know that it does work because it is FDA approved. And it was made by the same team that developed the leading professional LED device, Omnilux Medical. So clinical studies show that the greatest effects of light therapy is found with cumulative treatment. So most of the time too, when you're going to an office to get LED treatments, you're told to go once or twice a week, which can be hard for some people to go into the clinic that often, especially now with COVID. So the skin ages every day. So it makes sense to stimulate those cells on a regular basis, not just during clinic visits. So with this, the recommended protocol is 3 to 5 times a week for 4 weeks, and then once or twice a week for maintenance. It's only a 10-minute treatment. You literally put the mask on, you press a button, it times 10 minutes, and it'll go done. And the clients can use this as a standalone skin rejuvenation treatment, like without GlycoAla or other treatments, or as a booster treatment in combination with other aesthetic treatments. So this is going to help to boost the effects of any aesthetic treatment that you're getting in the clinic. And here is a nice before and after showing the visible reduction in redness and pigmentation. And so this was done, there is a clinical study done on, there are 2 clinical studies done on Omnilux Contour Mask as well. And with that, 96% of subjects agreed their skin felt softer and smoother at the end of the treatment. And 96% also said their skin felt plumper and hydrated. So we got really great results from this study. And the Omnilux Contour LED mask is at a special price of $350 each. It's typically $395, so this is another great special. And again, this mask is just a great anti-aging device to use on its own or with your professional treatments.
Okay, so we should probably ask if there's anybody on the call that has any questions about anything that we went over.
I was curious about, is my mic on?
Yeah.
Yes.
Yeah.
I was curious about the light. You said 3 times a week and you don't have to put any other product on, or you can put a product on?
No, you put it on clean skin. You can put a clear serum underneath, or we have a hydrogel mask. So it's a clear sheet mask that is full of glycerin, hyaluronic acid, vitamin B3, antioxidants that you can use underneath the mask for a more effective result as well. But you don't need anything underneath the mask. You just use the LED, you clean your skin, you put the mask on, press the button, stays on for 10 minutes, and then it goes off.
Even if you're using the mask, you only use it for 10 minutes?
Yep.
How much is the mask? How much is the mask?
The hydrogel mask? Mm-hmm. I believe they're $10 a piece.
Yeah, I think they're $10 retail. So, yeah. Good question.
Yes. Any other questions?